Cleft lip and cleft palate. The lip forms between the 4th and 7th weeks of pregnancy. As a baby develops during pregnancy, body tissue and special cells from each side of the head grow toward the center of the face and join together to make the face. This joining of tissue forms the facial features, like the lips and mouth. A cleft lip happens if the tissue that makes up the lip does not join completely before birth. This results in an opening in the upper lip. The opening in the lip can be a small slit or it can be a large opening that goes through the lip into the nose. A cleft lip can be on one or both sides of the lip or in the middle of the lip, which occurs very rarely. Children with a cleft lip also can have a cleft palate. The roof of the mouth, palate, is formed between the 6th and 9th weeks of pregnancy. A cleft palate happens if the tissue that makes up the roof of the mouth does not join together completely during pregnancy. For some babies, both the front and back parts of the palate are open. For other babies, only part of the palate is open. Other problems. Children with a cleft lip with or without a cleft palate or a cleft palate alone often have problems with feeding and speaking clearly and can have ear infections. Recently, CDC reported on important findings from research studies about some factors that increase the chance of having a baby with an orofacial cleft. Smoking women who smoke during pregnancy are more likely to have a baby with an orofacial cleft than women who do not smoke. 2-3. Diabetes. Women with diabetes diagnosed before pregnancy have an increased risk of having a child with a cleft lip with or without cleft palate, compared to women who did not have diabetes. 5. Use of certain medicines. Women who use certain medicines to treat epilepsy, such as topiramate or valproic acid, during the first trimester, the first 3 months of pregnancy, have an increased risk of having a baby with cleft lip with or without cleft palate, compared to women who didn't take these medicines. In a few cases, cleft lip and palate is associated with the genes a child inherits from their parents, although most cases are a one-off. Smoking during pregnancy or drinking alcohol during pregnancy. Obesity during pregnancy. A lack of folic acid during pregnancy. Taking certain medicines in early pregnancy, such as some anti-seizure medications and steroid tablets. In some cases, a cleft lip or palate can occur as part of a condition that causes a wider range of birth defects, such as 22q11 deletion syndrome, sometimes called DiGeorge or velocardiofacial syndrome, and Pierre-Robin sequence. The main treatments are surgery. An operation to correct a cleft lip is usually done when your baby is 3 to 6 months, and an operation to repair a cleft palate is usually done at 6 to 12 months. Feeding support. You may need advice about positioning your baby on your breast to help them feed, or you might need to feed them using a special type of bottle. Monitoring hearing. A baby born with cleft palate has a higher chance of glue ear, which may affect hearing. Close monitoring of their hearing is important, and if glue ear affects their hearing significantly, a hearing aid may be fitted or small tubes called grommets may be placed in their ears to drain the fluid. Speech and language therapy. A speech and language therapist will monitor your child's speech and language development throughout their childhood and help with any speech and language problems. Good dental hygiene and orthodontic treatment. You'll be given advice about looking after your child's teeth, and they may need braces if their adult teeth don't come through proper. Cleft lip and palate occurs in about 1 to 2 per 1,000 births in the developed world. 2. Cleft lip is about twice as common in males as females, while cleft palate without cleft lip is more common in females. 2. In 2017, it resulted in about 3,800 deaths globally, down from 14,600 deaths in 1990. 3. 4. The condition was formerly known as a hare lip because of its resemblance to a hare or rabbit, but that term is now generally considered to be offensive.